So this is going to mark the start of our final chapter that we need to discuss. And we're actually going to break this into two different conversations just because even though it is one chapter, the reproductive system, we do have the male and the female reproductive system, and they are so different from each other that we will take time to go over the female reproductive system, and then the following week we'll come back and we'll take a look at the male reproductive system. So this is kind of a culmination of the entire year. In Anatomy 1, we talked about some of the 11 body systems. We also had some of our foundational pieces and cells and things like that. And second semester, we picked up the remaining body systems that we hadn't talked about yet. So we are now down to talking about body system number 11 with the reproductive system. When you look at your female packet, you might right off the bat notice it doesn't have a whole lot of slides to it, but there still is a lot of information that we need to cover as we take a look at this particular chapter. So the first thing, if you are looking at the very first slide, organs of the female reproductive system, you have a cross-section of the female anatomy, and I'm going to take time to talk about some of these. Some of them I'm going to not go as in-depth with because I will pick them up on later slides. So we'll work our way down the left-hand side, talking about those structures, and move our way over to the right-hand side before we move on. So there's not a whole lot of space for notes. If you want to take your notes somewhere else, that's perfectly fine. But just to let you know that that's kind of the format as we work through this particular part of the packet. So initially, when you start at that top left-hand side, you'll notice the uterine tube. And this is one of those body parts where it gets multiple names, and certain names have become popular at different time periods. So you might have heard it referred to as something else. If you're more familiar with it, anybody that knows the female anatomy will know it either as the uterine tube, the oviduct, or the fallopian tube. Whichever one you like the best, you can use. I know it refers to it as the uterine tube here, but please understand that it does go by other names that are just as acceptable to use. Uterine tube I'm not going to spend a lot of time on right now just because it's not the greatest view of it. We have a slide coming up a little bit later. It's just going to show you a better view of that. So very close to the uterine tube, you're going to have the ovary, and the ovary is going to be the part of your reproductive system in which all the eggs are housed within the female body. So within the ovary, couple of prime things. Number one, this is where the estrogen is going to be released, which is the main hormone within the female body. And you are actually born with the number of eggs you will have for your entire lifetime. So at birth, that is already going to be filled with the eggs that you need to carry you throughout your reproductive years. Tucked just underneath that is going to be the uterus. And looking at this cross-section of the uterus, one thing that I want you to notice right away is the thick muscle layers within the uterus. So you can see from the cross-section that we have the same sort of setup that we've seen in your blood vessels, your lymphatic vessels, other places within the body in which you have an inner and an outer layer, and then sandwiched in between you have that muscle layer. The difference with this one is just how thick that muscle layer is. In other parts like your blood vessels, the muscle and the other two layers tend to be pretty much the same, but within the uterus, because of the job that it has to carry out, that muscle layer is going to be much thicker. Now, the other thing that you can't really tell about the uterus from this particular view is that the muscles are designed in a way that they don't run all in the same direction. So you will have a sheet of muscles that will run vertically, you have another sheet that runs horizontally, you have yet another sheet of muscle which is going to run diagonally. And that's because when baby implants in the uterus, there is nothing to say where baby has to implant. Wherever it finds a good spot, it will go ahead and implant. It could be at the top of the uterus, the front, the back, the side. And for that reason, when it comes time for labor to begin, if those muscles didn't run in multiple directions, you wouldn't necessarily have the uterus contracting in a way that would push baby down and out efficiently. And so because we never know where baby is going to implant, having that musculature running in multiple directions just ensures that those contractions are going to get baby out as quickly as possible. Underneath that, we have the bladder. And so if you compare that back to the uterus itself, you can see in a quick hurry why women will complain about having to use the restroom frequently, especially later on in pregnancy, because as baby grows and develops, yes, some of that will push upward into the abdominal cavity, but you can also see how that is going to apply pressure and constrict the bladder, so it doesn't have as much room to expand. So women will get the sensation that they need to use the restroom more frequently just because the bladder doesn't have the amount of room that it is normally used to. Underneath that, we have the symphysis pubis. This is going to be a bone, and it's part of the hip bone or the coxa. So this is the bone structure that runs through the front side, and this actually is going to help support the reproductive organs because it runs across the front, kind of builds in a shelf there to help support those structures and hold them in place. The next one that you have is the urethra. So we just touched on this when we went through our excretory chapter. The urethra is going to be the tube that takes urine from the body to the outside world. Now, in the female anatomy, we talked about the fact that this is only a few centimeters long, somewhere in the neighborhood of 3 to 5 centimeters in length, so it's not that long, much different within the male body. Underneath that, you have the clitoris. This is a location in the body in which you have a bundle of nerves. So compared to the rest of the body, that particular spot is going to have a higher concentration of nerves than what we see in other places. And when we compare the reproductive system, male to female, yes, there's a lot of differences between them, but this is actually going to be comparable to the penis within the male anatomy. And the reason for that is when there is stimulation, it is going to do a lot of the same things that the penis in the male would do. This is actually going to become engorged with blood and swell the same way. Again, higher concentration of nerves like we see in both the male and the female body. And so just because of those similarities, that comparison between the two has been made. The next two that you have are the labia, and you have the minus and the majus. A lot of times you'll see this as minor and major. So again, just depends on the resource that you are looking at. And they're the exact same no matter what subname you get with them. So I am more familiar with the minor and the major. And when you look at these two, these are referring to the skin folds that you have on the exterior of the female body. So minus is indicating the smaller of the two folds. The major is indicating so minus is the smaller of the two. Major is the larger of the two. And the way that you can distinguish between the two is the minor is going to be the folds of skin that do not have any hair attached to them. The major is going to be those skin folds that do have hair. The reason for these two skin folds in this particular location is because you do have openings to the outside world. So in the female body, you have 3 openings to the outside world in this particular region. You have the urethra, you have the vaginal canal, and then you have the anus. So because you have those openings, it's the body's way of creating somewhat of a barrier so that things can't easily get into your body. So bacteria, pathogens, other things of that nature, that there is a little bit of an obstacle so they don't have an easy opening to the female anatomy. Just underneath that, the last one that we have on the left-hand side is the vaginal orifice. So that is the opening into the vaginal canal. If you switch over to the right-hand side, first one that you have there is the fimbriae. The fimbriae are these finger-like extensions that you have at the end of the uterine tube, and you have a liquid environment, so those finger-like projections will actually kind of sway and create a current because of the fact that it's not enclosed. So the uterine tube and the ovary are not connected, they're not sealed together, and the ovary is going to be responsible for releasing an egg into the female body, and the fimbriae create that current to draw the egg into the uterine tube. Because it's not a sealed, secured transition, there is a possibility that the egg would float out into the cavity of the female body and not ever make its way into the uterine tube. So those fimbriae are just there to help kind of direct and pull the egg where it's supposed to be. The recto-uterine pouch, recto tells you it's behind, uterine indicating that it is behind the uterus. And if you look at it, it's just a little pocket that is created between the uterus and the end of the large intestine. Nothing really happens there. It's just a special space that you have between the two. Same with the fornix that you have there. It's another location where the vaginal canal and the uterus meet or come together. It's another little pocket that you get there. Doesn't do anything, but just because of this particular picture, that you can see it, they did go ahead and label it. The next one that you have is the cervix. So the cervix is the bottom third of the uterus. And some people kind of have this image, they hear the cervix so much, but they don't hear of it being connected to the uterus. But it is actually just the lower third of the uterus when you talk about the cervix. That would be what you were checking for dilation, to see how far a woman is in the process of active labor, depending on how dilated that location is. Then we have the rectum. So the rectum is going to be the last part of the large intestine that solid waste would be located in until it's ready to be eliminated from the body. And you can see with this picture, location of where the large intestine is, location of the vaginal canal. Because of the close proximity, there can be a lot of trauma during the process of labor to the large intestine, kind of disrupting how things work. And so one of the things that they will do post-delivery is they will check and monitor what's going on with the large intestine, just to make sure that things get back up and running the way that they're supposed to, and that the trauma from that birth didn't disrupt things too much. Then you have the vagina itself. So once you get past the opening and into the actual canal, some people would refer to this as the birth canal, you are looking at that vagina section of the female anatomy. And then we have the last one, and that is the anus. So this is the opening, that third and final opening that we have within the female anatomy, which is solid waste and where it would make its exit from the body. So just a quick overview of some of the major parts that we have in the female reproductive system. If you take a look at slide 2, it talks about the ovaries. So each female has 2 ovaries. We have a right and a left. And as I mentioned earlier, the female is going to be born with the number of eggs that she will have for her entire lifetime. And this is actually kind of a phase. So when you are going through the process of growth and development, still while baby is inside of mom, you have, it talks about several million eggs are going to initially be formed within a developing fetus. By the time you get to birth, that is actually dropped down to just about 1 million. So we start at several million. We eventually make our way down to about 1 million. And then we go through those beginning stages of life where we are not going through puberty, and that the number of eggs will continue to decrease. So about the time that you actually get to puberty and hit those reproductive years, you are down to somewhere around 400,000 to 500,000. Again, it's an estimate. You look at different places, you'll see slightly different numbers, but somewhere in the 400 to 500,000 range, which is well above the number that you would ever need. Most women, as it states there, in their lifetime, if they follow the what's considered normal trajectory of puberty from about 12 to 13 to about 45 to 50 years of age before you hit menopause, you will use or you will ovulate between 400 and 500 of those eggs. So you release an egg one at a time. So every month an egg is released. And over the course of a lifetime, like I said, if you hit those targets for the reproductive years, early teens to about 50, you will use somewhere between 400 and 500 of them. If you go to the next slide, it talks a little bit about the process of ovulation. And so this is just a picture of the ovary, and then you have the fimbriae, which are coming around the ovary on the right-hand side. The one thing that I hate about this, the one thing that I dislike about this picture is that it makes it look like it's sealed and it's fit together. That's not the case. Those fimbriae are not attached to the ovary. There is a gap between the ovary and the fimbriae. And as I mentioned earlier, when the egg ruptures and releases from the ovary, there is the potential that it never makes its way into the uterine tube. It can go off into the open cavity and never have a chance to be fertilized. But the fimbriae are in close proximity to the ovary. They are going to create that pull or that draw so that when the egg ruptures from the ovary, it makes its way into the uterine tube. That is the hope. Now, you have those hundreds of thousands of eggs within the ovaries, half of them in the right ovary, the other half in the left ovary, and they are kept somewhat dormant. So they are taken through the process of development up to a certain point, and then they're stopped. And the reason for that is because you have those eggs from the time you are a fetus, and it's going to be 13, 14, 15 years before you hit puberty. That's a long time to have those egg cells just kind of dormant and holding. So you don't want them to be fully developed and ready to go, because that's a long time to have something basically sitting on the shelf. And so they are kept in a dormant phase. So when you look at those primordial follicles, those are there, but they have not finished off their development. Once an egg has been selected to ovulate, then it's going to go through the process of developing, finishing off the process of meiosis. That's a semester 1 discussion, but meiosis is the type of cell division that our sex cells use. So once it's been selected to ovulate, it will then go through the process of finishing off development. So you see the different stages: the primary follicle, the follicular cells, the primary oocyte, all of those. That's just telling you that that egg is finishing off the process of meiosis, so it then could potentially become fertilized. Once the egg is fully developed, it's going to rupture through the wall of the ovary. Some people say that they can feel that sensation, that they know the moment that the egg ruptures through the wall of the ovary. And it does create a little bit of a scar. So that corpus luteum is actually the scar that is left behind when the egg ruptures and breaks through. And over time, that scar will kind of break down, dissolve, and go away. So once the egg releases from the ovary, it hopefully will make its way into the uterine tube and then track on down to the uterus. So the next slide that you have looks very much like the first one, but just designating the difference between the internal and the external structures. So when we talk about both reproductive systems, you do have some parts that are internal to the body and you have others that are external. When we talk about the internal parts, really looking at those uterine tubes, the uterus, the vagina, the ovary would fall in that one as well. Those are going to all be those structures that are going to